Hi everyone, it's Dr. Jhawar with Revive MD, Direct Primary Care. I want to talk a little bit about cholesterol today. So as a primary care doctor, I order lipid panels for a lot of my patients to test their cholesterol levels at least one to a couple times a year, depending on their medical conditions. And many of you have maybe had, a standard lipid panel done with your doctor before. But there are lots of people who have not heard of about an advanced lipid panel. And that's a specific test that a primary care doctor can definitely order for you. And I thought it'd be nice to talk about what the difference is between a standard lipid panel and advanced lipid panel, and maybe when you should think about getting that advanced lipid panel test. So the standard lipid panel test, has levels where you check your total cholesterol, your HDL, your triglycerides, LDL levels, and VLDL levels. The advanced lipid panel measures all of those numbers as well, but it's also measuring things like your LDL particle size and the actual LDL particle numbers, so it's very specific. It also measures, if you have a large amount of large HDL particles and what's the significance of that. Some of the other things that it measures is your apolipoprotein B and lipoprotein A. Now, if these are things that you've never heard about, I'm going to discuss them in future videos, so I'll explain what those mean. But all of these sort of together can really give you a sense and give your doctor a sense of your cardiovascular risk profile and whether or not really, you truly have more burden from bad cholesterol or not, and sort of how to improve that. So who are the people that should maybe think about getting the advanced lipid panel done? Well, definitely those who already have cardiovascular disease should probably get this done. Those who are smokers, possibly also even those who are diabetics, should really think about it. But even people who have very strong family history of high cholesterol or early heart disease, and also maybe those who, have had borderline elevated cholesterol levels, or those numbers have been slowly increasing, and maybe you have one or two other risk factors. Those personally are like a lot of the patients that I like to test this on to, so I can really see whether or not they would benefit from some other strategies and where their burden is coming from, where that cholesterol burden is coming from. So I hope that gives you some information about the advanced lipid panel, and just stay tuned for more videos where I'll get into more specifics about the details.